Okay, let's throw mine.
How's everybody doing today? Can you see if she's with us? Do you mind? I'm going to go ahead and get started. Okay, welcome to HPA 499.
Oh, she's like, no.
Okay, we are missing several people, so if you all can help me wave down people out there to make sure they know that we are people going to Costa Rica, I'd appreciate your help. Okay, without further ado, hello, I'm Celeste. Nice to meet you all. I teach in health policy and administration, and if you are with us today, that means you are coming to Costa Rica. So congratulations. Should be a fantastic trip. As you all know, this was a highly selective trip. I interviewed a lot of people for your coveted spots, please know. So I'm excited to have you join us. And let's go ahead. I thought it would be helpful actually start with a quick little bio on who I am and my background. So let's do that first, and then I'd love to hear from you because we need to get to know each other since we're going to travel to another country together. Okay. Is that showing up? No. Let's see. Here we go. All right. Now, of course it worked a second ago. Marcus was here.
We heard the glass box.
There we go. So, oh, we have the wheel. Okay, well while we wait for the wheel to do whatever it needs to do, I will just tell you I've been teaching comparative health systems, I think almost the last 9 or 10 years in health policy administration department. Took a little break this semester to do some research. Okay, now it's working. But I want to give you a little bit of background on who I am. There we go. Well, usually it shows you a screen so you can make it big. I don't know why.
Can you make it smaller, like the box?
I think if you would go to slideshow, and then start the slideshow.
Okay. This is my first time doing anything in this.
And then I think it's over, like out of the screen.
Yeah, it's on the
like
left.
over to the
Other side.
Other side.
Right there.
And then
Like, I'm sorry.
Yeah.
And then click over here.
No,
No,
so click play
right
from
above the
start.
number.
Play from start.
There you go.
There.
There you go.
Ladies, thank you so much. Okay. So I did my graduate work at Johns Hopkins University, and I studied the healthcare system in the Netherlands, and that was a very interesting experience. And then I spent 2 semesters as an undergrad at Oxford University in England. And then I also had the chance to spend 1 semester in Jakarta, Indonesia. Welcome. And that really, I think as an undergrad, piqued my interest in healthcare. And I started wondering about why other countries spend far less than we do on healthcare, and how come it is that sometimes those citizens are healthier than we are. So I hope that you'll ponder those questions in this course as well. So my first job out of college was working for the Healthcare Financing Administration, fondly known as HPA, before they changed their name to a much better name, I think, CMS. Anyone heard of CMS? Great, Centers for Medicare and Medicaid Services. And while I was there, I worked as a budget analyst and a quality specialist. I had some time on the Hill, which was great, preparing our administrator for his briefings, and I also had the chance to travel around and do a lot of compliance monitoring, and I had the chance to help draft policy and regulation. And I will tell you that there are live human beings that sit behind computers and draft all those rules and regulations. And oh, how fun it is then when you change sides and go work in the private industry and then have to live with the very rules you wrote. Yup, that's what I did. So I left the federal government after 5 years there, and we moved to Winston-Salem, North Carolina. And so we spent 3 years down at Wake Forest University, and I had a great time working for a physician-owned health plan owned by Wake Forest. It's called QualChoice of North Carolina, and I was the manager there of Medicare operations. Really interesting experience. So I was in charge of their claims department, customer service, and billing and enrollment. So if you've ever wondered how those little plastic cards get to you that you keep in your wallet, I had a whole department that produced those little plastic cards. You have to make sure the right numbers are on there and all those good things. And you have to interpret all the rules and regulations to make sure you're providing the health care that you've promised to provide to people that have signed up for your health plan. So I just want to make sure that you know that I have a lot of real world experience working in the healthcare industry. So after our time in North Carolina, we moved to State College, Pennsylvania, and I helped start the first free clinic in State College, known as Center Volunteers in Medicine. Has anyone heard of that? Oh, good. I'm seeing some heads nod. You haven't heard of it? No? Well, you should check it out. It's a great free clinic. Believe it or not, we have many people in our community right here in State College that do not have access to medical and dental care. Usually it's because they might work 2 part-time jobs, like at Walmart and McDonald's, and so they're not eligible for insurance through their employer, or perhaps they're unemployed because they lost their job. So Center Volunteers in Medicine relies on volunteer physicians and dentists and nurses, and we have a very small staff to provide the infrastructure to take care of people in need. And a big part of CVIM is providing the medicine, because sometimes people might have enough money to see a doctor, or they might have insurance that covers them going to a doctor, but they can't afford their medications, and they might have something like diabetes or high blood pressure, and they need that ongoing medication in order to stay healthy. Now, what's really interesting for you is we're going to spend a lot of time in this course learning about the healthcare system in another country. Can anyone tell me what country? Costa Rica, that's right. And in a country like Costa Rica, guess what? You wouldn't have to worry about that problem, because your medication would be taken care of if you couldn't afford it, because it's in the best interest of everybody in Costa Rica to make sure that you are healthy and that you are taking your medicine. So I had the chance to live in Costa Rica, I guess it was 17 years ago, because this little girl was 1 in this picture, and she is now 17, which I cannot believe. We were in the very small village of Cowita, and that's the little health clinic where we worked for a month. And it was a great chance for me to learn about the healthcare system in Costa Rica, and I really became passionate about sharing the information about Costa Rica with other people, because I think that so many individuals in our country don't know about healthcare in other countries. So I'm also passionate about medical relief work that I'm involved with outside of my Penn State employment. So we try to go down to Nicaragua every year or every other year. We've kind of started to do it every other year, just because it's hard to get off for every spring break to go down to Nicaragua. So this picture was taken in the dump. We were in the city capital of Managua in Nicaragua, and it's really interesting. This big cinder block wall goes around the center of the dump, and the lady that we work under, she bought that land privately from the government so that she could have a feeding station, a clean place to have a feeding station, and have medical teams come in to provide medical relief work. And outside those walls, it is unbelievably dirty. I'm not sure if you can even imagine how dirty it is. Wish we could dim the lights in here so you could see better, but everyone see okay? So you have to just imagine how windy it is on the other side of these walls. The living conditions are deplorable. There's burning trash, because we're in the middle of a dump, and there's dump trucks like driving through on these makeshift roads. Most people that I know that might have a dog have better living conditions than what these poor people were living in. It was so sad. What was impressive, though, to me was that the people would come to medical clinic clean, and yet they didn't have running water. And they wore their best clothes, and they didn't have very many clothes, and they didn't really have a very clean place to keep their clothes. And they were very proud. They were also so appreciative of the medical care that we were providing to them. Our goal was to, first of all, do no harm. So the medical interventions that we could provide in a setting like this were very limited. We could deworm the individuals. We can provide birth control. We can check them to see if they are diabetic. Right here we're checking this little girl's blood sugar because the physician wanted a screening on her to see if her blood sugar was normal. We can give people vitamins, and we can refer people to the Ministry of Health. But there's really not much you can do in this kind of setting. Just very basic medicine. But going to Nicaragua year after year has continued to drive my interest in international and global health, and I thought you would be interested in just knowing a little bit about my background and what I do outside of my time at Penn State. So now I'd love to hear from you, and I think just so that we can also share the information with the people that aren't in the room right now, if you can come up here and introduce yourself and tell us one thing about you that will be of interest so that we can get to know you. Allie, can I start with you? Come on up.
Well, I don't know anything interesting.
Oh, it can be, how about your major, your year? That'll be fine.
Okay.
You can do it.
Where's like the camera at? Or is it like a camera?
I think you're on.
Oh, that's me.
Yeah, you just have to like be close enough to the middle so they can see you. Yeah, if you can see yourself on there, you're good.
Am I here?
You're here.
Okay, so I'm Allie, and I'm a junior in Health Policy Administration, and this semester I'm TAing for HPA 101.
Great.
But
Thank
anything
you so
else?
much.
Okay.
Yes. Okay. Who's next?
Hi guys, I'm Katie. I'm a sophomore in Health Policy Administration right now, and my past summer I spent interning with the Department of Health.
Can you come here for a second? Great. Who's next?
Hi, I'm Megan. I'm a junior in Health Policy Administration, and I'm in the blue band up here.
Ooh, great. What instrument do you play?
The silks, so relax.
Awesome. Okay.
Hi, I'm Emily. I'm a senior in HPA. And this past summer I spent in Washington, D.C. interning at a HIV nonprofit organization. So,
Which one?
Health HIV.
Great.
Yeah.
Good.
Hi guys, I'm Amanda, and I'm a senior in biochemistry and Spanish. And so actually, a year and a half ago, I studied abroad in Argentina, and I had an internship at a public hospital. So you can compare to the health system.
Great. Thanks for sharing.
So just like naming your major, just like fun fact.
Yeah, if you go here though.
Okay.
Thank you.
So just see this.
Hi everyone, my name is Kokila. I'm a senior biology major, and I'm involved with Penn State Ballroom Dance Team.
Oh, great. Thank you.
Hi, I'm Caroline. I'm a junior in BBH, and I'm your TA also. And next summer, I will be traveling to Africa with the Global Health Minor.
Woo! We're telling you on the trip this year.
Huh? Oh, I went on the trip last year.
So if you have any questions about what you're going to experience, Caroline is a great person for you to talk to, okay? Well, we have a few logistics to take care of before I can begin our lecture. And then if you can save your questions for over lunch, that will be fantastic, because we have some more time together over lunch. So did everyone get a piece of paper that looks like this and has a piece of paper like this attached to it? Yes, okay, great. So this is really important. This is due December 1st, back to me. And this is a permission slip that will allow you to participate in this trip. So the reason that it's due December 1st is that if you have a professor that does not allow you permission to go on this trip, guess what? I'm giving you plenty of time. Take a different class, okay? I've never had that happen, but what I want you to do is go visit all your professors that you're going to have spring term and say hi to them and make sure that they're aware you're going to miss the second week of class. It's only 4 days because it's MLK week, but you need to make sure that you write down the professor's name. So let's say it's Dr. Diane Spokus. So you write there, list professor name, Dr. Diane Spokus. The course, let's say you're taking 97, or what are you TAing?
96.
96, okay, so you would put like 96 right there, and then her email address, because I will email her to make sure that she really signed this. And then she needs to sign it right here under professor's signature, okay?
So this is like one paper for all the professors.
Right, so if you have 5 other classes, you're gonna list your professor's names, course, and email, okay? And then you need to return this to my box on the 6th floor of the Ford building by December 1st.
And what if it's an online class? Is there Wi-Fi?
If it's an online class, it's acceptable for you to communicate with your teacher by email and just staple a copy of this with that professor's approval for you to miss class that week to this, okay? And sometimes professors ask about online access, and I would really recommend you don't commit to doing anything online because I think the biggest challenge for the students last year was very sketchy online service. So it's much better for you to do your work ahead. So if you have a quiz the second week of class and your professor is hesitant to let you go because you're going to miss that quiz, what I'd strongly recommend is you offer to take the quiz before you leave. And if they say no, they don't want to give it to you early, then they should offer that you can take it when you get back. But don't offer to do it online from Costa Rica, because our internet service, unfortunately, is not very strong in many of the remote locations where we stay. And if you want more information on that, you can speak with Caroline. She experienced it firsthand.
Yeah, it was definitely like make sure you do like everything beforehand, because even when I was on the trip, one of my professors, like I didn't realize, because the first night it's like really like good Wi-Fi, but after that I didn't realize it was going to be like really, really bad. I thought we were going to have Wi-Fi, and so like I didn't realize this, so I emailed my professor. I was like, here's my homework, I'm so sorry, like I can't get the box to work, whatever, and like I like failed the assignment. So like just make sure you like get that stuff done beforehand and don't rely on the Wi-Fi because it's very sketchy.
Yes, yes. Okay, so because of that, we are going to do our homework every night in this handy little journal. Did everyone get a notebook and a bookmark? Okay, great. And I have my black magic marker with a green piece of tape on it going around. If you can please put your name in big letters on the front of your notebook so that I make sure I know whose homework I'm grading every night. That'll be fantastic. That's your notebook to enjoy. You're welcome to put as much information about this class as you wish in that notebook, but do keep in mind you might not want to put love letters in there because I'm going to be getting the notebook every day. So you will turn that into me every night at dinner time, and I will read it after dinner, and I will give it back to you at breakfast every morning, okay? So one thing I would encourage you to start thinking about is you might want to do some of your homework at lunchtime when you have a flat surface to write on. Sometimes they have long bus rides, but you have to have it to me by dinner so it's not counted as late, okay? In the past, we have done some of this online, but we had such terrible service last year that the students really recommended we go back to doing it an old-fashioned way. So that's why I bought you all notebooks. All right, very good. Let's see, another piece of housekeeping and logistics that I want to go over is roommates. I need to have you all sign up for a roommate, and then Caroline's going to put it into a Excel spreadsheet for us. Does that sound good? Okay, so if I can pass this around and you please put the person that you wish to room with next to your name, that will be fantastic. And if somebody is not here that you're wishing to room with, can you please indicate that as well? Only 2 people per room, please. Okay? Let's see, what else? You will be receiving an email regarding your HCH International Health Insurance provided by, I guess it's done through Penn State, but you have to pay $1 a day for it, I believe. It's not much. It's great. I will tell you, it's a wonderful policy, and it's great to have that extra coverage. All right, there is 3 students missing their flight information at this time. Do you happen to know which 3 students that might be? You're one of them?
I think so.
Did you purchase your flight?
Yeah, I just didn't put it.
Can you go on World Strides and log that? Because we can't
Yeah.
announce the shuttle times until we have all students' flight information arranged. Okay, so if you will do that, then that will help us get the updated information from our contact at World Strides. Okay, great. And then can you work on the other 2 people that are missing?
Yeah.
Thank you. Great. Okay, meeting times. I just want to make sure that everyone's on the same page and that you are all able to be here Friday, December 9th, 11 a.m. to 2 p.m. Whew, we will take a little break.
No, November.
It's Friday, December 9th. That's our lecture number 2. It's going to be a big one because this one's very short. We had to have a truncated meeting time today due to somebody else being in the room right after us at 12:15. So we are going to continue with our time together. We'll have an informal lunch. So I hope that most of you can stay for that. But our next big chunk of time together will be December 9th, 11 a.m. to 2 p.m. And then again on Wednesday, January 11th, right before we leave, that's the week before we depart, 12 to 2. Okay, so we'll finish lectures then. You do have to enroll in this program called STEP, Smart Travelers Enrollment Program, through the U.S. Department of State. And I need for you to provide documentation of that. Screenshots, please. Please send those to Caroline and myself so we can mark on our end that you have complied with that Penn State requirement. Okay? So, roommates, flights, health insurance, notebooks. And I'm going to ask if you can hold your questions because we need to cover a lot of material. So our objectives for our time today, number 1 was to go over logistics. And then we're going to move on to the lecture component of our time together. I'm going to talk a little bit about what I call Tool 1, which is GDP, the Gross Domestic Product, and we'll talk about HPA, Human Development Index. And then I want to make sure we also talk about social, political, and cultural influences and how those influences affect the health of a country. And then we'll continue on with our discussion. Okay, so we do have a book that I'd like for you to read. It's called Mountains Beyond Mountains. Has anyone read this book yet? Oh, you're going to love it. It's such a good book. It's about Dr. Farmer and his quest to cure the world. I think you'll really enjoy it. So go ahead and go on Amazon. You can buy it used for a bargain. I just wanted to give you heads up about that. We'll also have some optional readings, and I'll have some other readings that I'll post online. So just a little warning, this presentation may be dangerous to your perceptions of health. So what is health and what is health care? We're going to talk about that a little bit. The World Health Organization defines health as a state of complete physical, mental, and social well-being, and not merely as the absence of disease or infirmity. And it's interesting for you to start thinking about health at the individual, community, and global level. So as an individual, do you feel like you have good health status? Are you healthy? Did you get enough sleep last night? And then at the community level, how healthy is our community? We talked a little bit about people in our community that might not have access to health care. And I mentioned that I was involved in starting the free clinic in town. So that would be to help improve the health status of our community, right? And then at the global level, think about flu and diseases that can spread worldwide. Polio. There are many global diseases, and it's important from a public health point of view that we are aware of the status of those diseases to keep our populations healthy. Well, I promised we'd talk a little bit about GDP, and the reason is because GDP is an interesting component that allows us to compare countries on an economic level. So we can look at GDP as an indicator. And this is something that we can define in common units. But what can we count and what can we compare? Well, let's talk about this. What does GDP measure? GDP measures the total amount of goods and services that are produced within a country's geographic borders. So an example is an American company, let's just say Dole, with a plant in Brazil will actually contribute to the Brazilian GDP. Okay? So the most common approach to measuring and quantifying GDP is the expenditure method. And it's consumption plus gross investments plus government spending and then plus exports minus imports. So here's a little formula for it. And don't worry, I'm not going to make you do any math in this class. It's okay. I just want you to understand what GDP is so that if you are writing a homework assignment about the GDP in Costa Rica compared to the United States, you understand what GDP is, okay? So there's a little map that I like showing the different levels of GDP, and you can see our nation as well as our northern friends are at a higher level of GDP. See the dark blue? Okay. And then the colors change accordingly. Okay. Economists have preferred to split the general consumption term into two parts, private consumption and public sector spending. So just so you're aware of that. We spend 2.5 times of the OECD average. So I like to show things in different ways, just so you know. So I like to have a lot of graphs, just for your viewing pleasure. Well, let's look at healthcare dollars and where they went in 2008. How much are we spending on healthcare in our country? A lot. So a lot on healthcare, hospital care, and professional services. And when we look at GDP per capita, there's the United States over here. And what I really love to do is to map it out against life expectancy. So look at that. We have a very high GDP per capita, but do we live as long as the people in Japan? No. I wonder why. Now where's Costa Rica on my map? Let's see if we can see. I think Costa Rica is probably one of these very little blips here. And Costa Rica is just right neck and neck with us in terms of life expectancy. So we'll learn more about that in this course. Okay, so this is looking at GDP per person. Oh, I think I included this one so we could see Costa Rica. Well, I found Croatia. Does anyone see Costa Rica?
I think it's above Mexico to the left.
it's there, yeah.
There it is. Yep. Thank you. Thank you. Thank you. So they are very tiny there. Yep. They have a nice long life in Costa Rica. All right. So this is just another map. I included this one because it was very interesting, showing life expectancy at birth and healthcare spending and health status. So what's sad to me is, why are we down here? What are we doing wrong? And I hope this course helps you ask a lot of questions and try to eventually make some policy changes to improve the health status of the citizens in our country. All right, so this is an interesting chart that my colleague Dr. Brzezinska put together, showing infant mortality and total healthcare expenditures. And so as you can see, according to his research, we are pretty wasteful with our healthcare dollars. And this one looks at social expenditure as a percent of GDP and child poverty. Child poverty is hungry children, children without adequate health care, children without a roof over their head. It's pretty sad, and we are here. So we leave a lot of room for improvement, I'll put it that way, compared to other nations. Okay, percent of GDP spent on healthcare in the United States. This is a quote from President Obama in a speech that he gave to the American Medical Association in 2010. Today we are spending over $2 trillion a year on healthcare, almost 50% more per person than the next most costly nation. That's a lot of money. What I want you to understand is that we're spending much, much more than other nations. So 17.7% of our GDP was spent on healthcare as of 2011, and healthcare costs absorbed 24.1% share of the nation's economic growth between 2000 and 2005. When I peeked at the most updated numbers recently, we're still at over 17% of our GDP spent on healthcare in 2000, and I think that was based on 2014. Yes, I'm right, and that was from the World Health Organization. So you might be wondering, how much money do they spend on healthcare in Costa Rica? 9.3%. So much less of their GDP is spent on healthcare than we do in our country. So that's something you need to know. I also included the links there because you'll probably need those for your homework assignments. And I do recommend that you go into this trip with having gathered a lot of your data, and maybe even just take the paper copies, take some printouts with you so you can reference for your homework assignments, so that you're not relying on a laptop that may or may not get internet access during the trip, okay? All right, here's another slide just showing GNP per capita. This is looking at some other nations. Okay, let's move on to HDI. This measures the quality of life and well-being. So the level of economic development usually, but not always, corresponds to a level of income per capita. So the Human Development Index, otherwise known as HDI, attempts to compare well-being, especially child welfare, across countries. I included a little bit of information there if you're interested about how HDI came about and the background of it. It's a measure of average achievements in a country in terms of a long and healthy life as measured by life expectancy at birth, along with knowledge, which they measure knowledge by adult literacy rate, and that gives 2/3 of the score, with the combined primary, secondary, and tertiary gross enrollment data ratio, with 1/3 weight. That gives part of that score. And then also a decent standard of living, and they measure that by the GDP per capita using purchasing power parity in US dollars. So basically, I promise I'm not making you do any math on this course, but I just want you to understand, where do they get these numbers? So the HDI in our country is pretty high. We rank number 8. If you stacked countries in terms of HDI, we're not bad. And Costa Rica ranks 69. And so I gave you the website as well for where I pulled that information. So you might want to take a look at that and do a little bit more research on HDI. It's a very interesting measurement, and it's something quantifiable that allows us to look at different countries in different ways. Okay? And this is also a map that just shows the HDI of different countries. All right. So now let's move on to the third component of what I call Tool 1, and that is the social, political, and cultural influences of a nation. We've talked about things so far that are easy for us to measure, right? GDP and HDI. Those are very quantifiable, so they're easy for us to get our hands around because we just go to the CIA fact book and pull up the information on the United States of America, and there they give us all these great numbers. Or we can go to the World Health Organization and pull some information off from there. Same thing about Costa Rica. But there's also things that we can't measure. There's factors that are hard to quantify. Oftentimes we call those health determinants of a nation. So a country's cultures, values, and ethos play a big part into this. So I'll just back up for a second and give you an example, because you're going to see this in person in Costa Rica. In Costa Rica, it's very culturally acceptable to breastfeed your baby. And it's actually very encouraged. So it's not seen as weird for mothers to be publicly breastfeeding their babies in the hospitals that we visit and in the healthcare clinics. Sometimes the children may be as old as 2, because the World Health Organization encourages mothers to breastfeed their children up to age 2. And you'll see the providers there really encourage their mothers to do that, because the babies are getting the immunities from the mother, and guess what? They have very healthy babies in Costa Rica. Something else that's very interesting, though, is that they have mandated maternity leave. So you have to take your maternity leave in Costa Rica. Why? Because your job is seen as very important, and you have to take care of your baby. They want you to stay home with your baby and breastfeed your baby. So you're given time off to do that, and that's a government regulation. So not only is it culturally acceptable that you nurse your child, but it's also just reinforced by the government. And I will say that there's also perhaps a little more religious influence in Costa Rica. Almost everyone in Costa Rica is Catholic, and so it seems to me that the religion also supports the mother being the primary caregiver for the child and providing as high a level of quality of care for that baby as possible. So other things that are important to consider might be how well a nation might provide basic needs to their citizens, the sense of community and social capital, how much they support early life. So obviously we're talking a lot about Costa Rica in this embedded program because we are going to have the chance to go to Costa Rica. But there are other countries also that provide very high levels of care early on in life. And we really see that with our Scandinavian countries. The Netherlands, Denmark, Switzerland, they do a fantastic job supporting mothers and babies early in life. I know when I did some research a few years ago in Denmark, it was interesting to find that they also had maternity leave where your job is guaranteed, your job is held for you for a full year, you're paid during your time off, and then your husband gets paternity leave, or your partner gets paternity leave afterwards, so they have time with your child as well. And it was also interesting, in Denmark, same thing, breastfeeding was expected. Nobody could imagine not breastfeeding their baby, so that was just a cultural norm. It was expected. But also, I will say the medical establishment supported that. You know, they really encouraged the mothers to do that. Whereas in our country, it's much more of a choice, and that's a cultural norm. You know, you can choose if you want to breastfeed your baby. Okay, so let's see, where were we? How much do they support all? And what I'm talking about there is our social welfare system. Everything, it's all related. Sometimes you might see economic growth, and it's good to ask yourself, is that growth shared? Is that growth, especially when it's rapid, is the entire population benefiting from that, or just a few people? And sometimes in countries, you might see very rapid economic change. We're certainly seeing that in China right now. They're having a lot of change in their country. So there are political systems that redistribute some of that wealth, and there's political systems that don't. And I'm sure we'll have a lot of time to talk about those things on our long bus rides. All right, so it's also interesting to look at different countries from their political and economic setup. You know, are they a hierarchy, or are they more socialized? And I'll just use Japan as an example. Japan is very interesting in that economically, people aren't that different in Japan. So like if you're a bus driver, you might earn this much. And if you're a CEO, let's say you're a middle manager or a teacher, you might earn this much. And then a CEO might earn a little bit more. But they're not that different in terms of how much money they're making. Whereas in our country, if you are a CEO, your salary is way up here. If you are a bus driver, you're way down here. So the difference in our country is significant. In some other nations like Japan, the difference is not that much. And what's also interesting is we see in a country like Japan, people live longer. So sometimes these determinants might not necessarily be something you would think could be related to healthcare and perhaps longevity and your overall health status, right? But they are. Okay. Access to primary care. So of course, it's important to have access to primary health care if you were hoping to have the best health possible, because when you're sick, you want to go to the doctor. And you need public access to public health programs. How do we keep the water clean in our country? You're getting ready to travel to a country where you might be afraid to drink the water that comes out of the faucet. But Costa Rica is the one nation in a group of nations where you can drink the water that comes out of the faucet. It's very safe for us. It won't make you sick. But if you go next door to Nicaragua, you would get very sick if you drink that water. So it's important for you to start thinking about those things. So health disparities will certainly come up in this course, and it's part of Tool 1, because you're going to be going to a country where you might see more poverty than you're used to seeing. And you'll also certainly read about it in the book that we're reading. I was struck by the differences in the kinds and amounts of medical care that people in the U.S. used, and was concerned about why some had good access to medical care and others did not. So we talked a little bit about water and public infrastructure. and in regards to the U.S. healthcare system and also in Costa Rica. So in addition to water, I'd like for you to start thinking about sanitation. When you flush that toilet, where does it go in our country? Because you'll get to see, hopefully in Costa Rica, where it goes. And energy. I would like for you to start thinking about this. In our country, when you turn on the lights, where are we getting that energy and what's it doing to our environment and the air that we breathe? And then when we're in Costa Rica, I want you to ask the question, how do you produce the energy that you use in your country? Because I think you're going to be fascinated by the answer you find out. So in our country, how do agencies and divisions manage health on the national, state, and local levels? Well, we do it lots of different ways. We have the city regulators, we have the county regulators, we have the state regulators, we have the federal regulators, which I got to be a part of for a while. And they all want to regulate everything. So I think we're doing a pretty good job in that department, but it requires lots of different federal organizations, state regulations, agencies, you name it, I feel like we have it. We talked a little bit about the Centers for Medicare and Medicaid Services because I used to work there. That's under Department of Health and Human Services. We have the Centers for Disease Control. We have the National Cancer Institute. Whew, it goes on and on. There's also lots of private organizations that monitor health status, investigate, and establish goals. So I included some of those there for your viewing pleasure. And links as well, because a lot of these links will help you as you do some research to prepare for our trip. And so feel free to peruse those links. Okay, well, in summary, today we briefly discussed logistics regarding our trip. I think we talked about roommates, airline tickets, the State Department website you have to go on and take your screen captures. I gave you the list for your professors to give you permission. We talked about the fact that's due to my box December 1st, right? Okay. We also talked about GDP and HDI, and then we finished by discussing social, political, and cultural influences and how they affect the health of a country. So we are actually ahead of schedule, which is great. So we can do the questions now so they can be taped for our friends that are viewing this online. So if you want to ask questions now, that would be great.
Can I just run a quick review of the State Department website? What are we supposed to do for that?
It's called the STEP program. You just click on that and it asks you like which country are you going to, and you just enter your information, and it's just in case there's an emergency. It's very similar to the one that Penn State wanted us to do, but then Global Programs changed their mind.
Okay.
Sorry about that.
Okay, cool.
Yes.
So who are we handing in, like, once we get signatures from our teachers, who are we handing it into?
That's also due to my box December 1st.
Oh, your boss. I thought you were saying my boss. I was like, who's your boss?
Oh, my box. Sorry.
Boss. Okay.
No, my department chair probably really doesn't want all those pieces of paper,
Yeah.
but she is a lovely lady. So you're welcome to say hi to her, but yeah, put the pieces of paper into my box. And for our friends that are online right now that might not be here at University Park, if you are able to obtain email documentation from each of your professors, that will be helpful. And you can fill the same form out listing each professor and their name and their email address, and then email that documentation to Caroline. Wave, Caroline. I don't know if they can see you, but and myself, and we will make sure that we gather information for you. Okay, does that sound good?
Mm-hmm.
Great. Yes.
This is more of a personal question, but one of the professors that I'm going to be having in the spring had a medical emergency, and I'm not sure if she'll be doing that.
Maria?
Yeah.
She said that, so she's supposed to be back after Thanksgiving break.
Oh, so she will be back?
Yeah.
Okay,
She will
so for her signature,
Okay.
yeah, would that be okay if we don't get that to you until after the 1st, just for her class?
Mm-hmm.
Okay.
And I think you can also email her.
Okay.
I bet she'll be doing emails, just knowing Maria.
Yeah.
Okay.
And if you want,
I
put a little note on there,
her.
say see attached email. So what I would like you to do though, it's fine for you to send the email to me, but what I need for you to do is print the email out and staple it to it. And then put a little note on there, see attached email.
Are you aware, or is this for HPA 32?
Yeah.
So is Joseph, is that who's taking over for her?
Denisio?
Oh, no, the class I have her for would be 310, and then I have Denisio for 332 as well.
Okay. I will tell you, Joe Denisio is one professor that really appreciates you coming to him now.
Okay.
and asking him for permission.
I think he might be taking over. I'll ask him for sure, but I'm pretty sure he's the guy that's taking over for her until she gets back.
Great.
He's wonderful.
Well, for one of
Good.
my classes, it's it starts with an S. Caprice Nap.
Now.
That's who is taking over the one that I have her for now.
Okay.
Maybe it's a different one.
Yeah, I know he was like a guy. He like stopped in, and I like looked up his picture, and I think it's him, but I'm not positive. But I have him next semester.
Great.
So I can like get him.
Good. Just if you can please start working on it now and finding out when these professors have office hours so you can go visit them. That will be very helpful. I should mention to you as well while I'm thinking about it that next semester I'll have office hours every Tuesday and Thursday afternoon, location to be determined. So if you need to see me between 1 and 2 o'clock, will be guaranteed access, but I'm also available other times by appointment. No problem. So I do encourage you to visit me during office hours. You do have a research project with this class. Yes.
This is what I was just gonna ask. So once we get back from the trip, is it almost like we have to develop the poster for the presentation and it's kind of like an independent, we do that on our own type thing?
Yes.
Is that the research project?
That's the research project. And I think since we have time, I'd like to show you an example of a poster and the research project, just because that will help you a lot. Caroline, can you help me pull up the HHD website for the trip?
Oh, yeah.
Do you know what I'm talking about?
Yeah.
That'll be great, because I can keep answering questions while Caroline pulls that up. Yes.
So like what, like schoolwork wise, like what is like required for this course, and then like how long does it last? Like is it the whole semester? Is it the first month, or like you know what I mean? Like
this is a semester long course, but the lovely thing is that we earn most of our contact hours in country, so we need to meet very little once we get back. We do meet 3 times before we depart, so we'll have a formal lecture time 2 more times, and then we get most of our contact hours in country. We only have 1 meeting afterwards, and we need to decide on when that post-trip meeting will occur. So I think I'll ask Caroline to send out a Google, a doodle poll that she sent out for finding this time to meet. We'll do the same thing. I try to do it probably the week after we get back, or the following week, just so that everyone is still retaining the information about the trip and everything's still fresh in your mind. And then you have to come to the Stanley Mayer's lecture, and that date I can share with you very soon. That should be coming out soon, and do your research project. Okay. So at the next class I should have the syllabus ready. We're a little bit off track in that this is a spring course, but we are meeting now, so I should have that information together by our next time together.
Are there like exams or anything?
There's no exams.
Just like
no.
the homework and the project.
The homework, the research project, and your class participation.
Really?
Yes. So I will say there are points associated though with every little thing, like turning in the form that you have to get your professor's signature on. That all that counts towards your grade.
Okay.
You mentioned printing out information beforehand to help
Yes.
us with our homework. Are we
Yes.
gonna know like what our homework is so that
Yes.
we know what papers to print out?
Absolutely. Yes. Okay. That's one thing that I want to make sure that you know exactly what your reflection assignment will be every night, so that you can print out the corresponding material that you might want to reference for your write-up that I'll be reading.
How do we access that? Is it going to be like on Canvas?
It'll be on Canvas or Angel. Yeah, I haven't decided yet which one. So one of those platforms, and the information you'll print out is pretty basic, but you will want some of that information. The other thing I would encourage you to do is to start thinking about your research project. So, can you do the link to the main trip website? Right there, great. And then if you scroll down, oops, there it is, go there. At the very bottom is Bridget's, right there. Oops, keep going up. Right there, that big long thing. Okay, I would love for you to start thinking about your research project, because the more time you can spend thinking about it now, as we go through the lectures about the 6 different tools I'm going to ask you to reflect on, it will help you think about whatever topic it is that you want to learn more about. So if you're really interested in immunizations, or if you're really interested in how healthcare is delivered and the primary care model, start thinking about that now so you can capture all that information. Okay, here's an example of someone's presentation. You're also required to go to a class and present your poster and use the information. Most people put it in a PowerPoint slide. So
Any class.
any class you want. I prefer HPA, of course, because this is a Health Policy Administration trip, and I like to give you lots of advance warning. I don't want you to have any surprises, but here's the sample. Okay, Carol, we're ready. Oh, what you have to do is go like this, I think. I think you like drag it. Huh. Let me get Marcus.
I have to head up to the interview now. Is that okay?
Yeah. Okay. Yeah, we talked about that.
Sure, go on the main trip website to look at
I
the.
can look at that online.
Thank you so much. Sure. Meet all you guys.
We're just trying to get that loud enough.
Okay.
Thank you, Caroline.
Hello, my name is Bridget Wheeler, and I'm here to talk to you about a wonderful opportunity given by Health Policy Administration here at the Pennsylvania State University. Now, this wonderful opportunity is a trip to Costa Rica for 1 week in January 2017. Now, this trip has so many things that you cannot even imagine, and you're also able to receive credit for HPA 499. So the first thing this trip is able to give you is the ability to give back. Here in this photo, you can see we gave an athletic wheelchair to a young man. This wheelchair will give him capabilities of do so much more than he was able to do in the first place. Another thing is you get to see the history of Costa Rica. You're able to go on a nighttime tour of the capital and see all different things that I personally didn't know about this third world country. On top of the history, there's of course healthcare. You're able to travel to all these different clinics as well as hospitals and get a full tour of every aspect of it. You're able to interact with patients and see the top-notch hospitals and clinics to all the way to the lower hospital and clinics. And also, you're able to compare the public as well as private system that there is in Costa Rica. You're also able to interact with administration people, nurses, anyone that's giving you a tour, and they really do give you a full understanding of what the citizens of Costa Rica are really provided with. Now, it's not all just healthcare, there's also some fun. You're able to do things such as travel through the rainforest or go to different small shops and interact with locals. This gives you the full culture Costa Rica has to offer. On top of that, we were able to interact with a Penn State alumni who actually joined the Peace Corps. So it was really great to see how his experiences when he went to Costa Rica really shaped his future. Now, on top of all this, you're absorbing so much information that you don't even realize. So, when you come back to Penn State, you're able to complete your own research. Now, like I said, I was shocked by what Costa Rica had to offer in their healthcare system in public as well as private. So I did my research on why the World Health Organization ranks Costa Rica a step higher than the United States. Living in the United States my whole entire life, I had to experience every aspect of the healthcare system we have, as well as studied it. So I decided to compare Costa Rica's quality as well as access to care. Now, their quality of care is actually better in their public instead of their private. Their private deals more with short-term things. This way it has higher bed turnovers. Their public system is great and is completely affordable, if not free. The only downside of their public system is that there is longer wait times. So if they don't want to wait, they do have to pay for private. Now, for their access to care, they have 3 levels. They have clinics, small hospitals, as well as large hospitals. This really helps them to reach people in even the most rural areas. On top of that, they have home nurses, which are called ATAPs. Now, these ATAPs physically travel to these people's houses. We were able to meet a wonderful family from Florida who got to experience both healthcare systems. The mother said that it really made her pregnancy that much easier. Being 7 months pregnant and having a working husband, it was great for our ATAP, Sandra, to go see her without her to have to travel. Sandra has also been with the family the whole entire time their daughter Indy was alive. This means the 7-year-old really is comfortable with her and is even more comfortable because she's home. Her mom explained how this really makes the healthcare that much easier, and it also makes her daughter more comfortable with getting shots and different things because you feel so much more comfortable. That's why their access to care is great, but having such great access also makes their quality of care that much better. And that's why I do agree with the World Health Organization that Costa Rica should be a step higher in the United States. Now in the picture behind me, you'll see Dr. Hernandez, who is a presidential candidate for Costa Rica 2018. He said my favorite quote of the whole trip, which is, Costa Rica is a third world country with a first world healthcare. I strongly suggest you getting the opportunity to experience this yourself, to see what a third world country could still do with their healthcare, and maybe even see changes you think should be made in the United States. And if you're interested in this, Celeste Newcomb is the instructor on the trip. Here's her contact information, and feel free to ask her any questions about pricing or anything you feel like I may not have gone over that well. I appreciate you listening and have a wonderful day.
Good job, Bridget. Okay, any other questions? Great. Did everyone sign the roommate form? Okay. Yes, 1, 2, 3, 4, 5. So I had 7 people here, right? One for Katie left. Okay. Can you make sure that there's 7 people signed up on that form?
There's like 7 including me.
Great. Okay, lovely. Okay. So we just need to be in touch with our students that are not here.
Someone emailed about like roommates.
Yeah. So we can fill that out for them, and then you can put it in an Excel document if you don't mind. Okay. Lovely. I know there's one person, Serena said she'd be happy to be roommates with any other female, and luckily we're all women on this trip, so that makes that easy. So no questions regarding roommates? Great. No questions regarding flights? Okay. Great. Does everyone know they have to get themselves to the airport? Okay, I strongly encourage you going with somebody. Take a buddy. I also really encourage you park in covered parking. Last year we had a little situation where some snow came down while we were gone, and so people came back to cars buried in snow. So I would encourage you to pay a little bit extra and park in the parking lot so we don't have that problem.
Can I just ask a question? Did anybody get like out of Pittsburgh? Like there's like you are, and what did you are?
Well, I got my flight I got the email that my flight the times changed.
So you're not at 8 whatever.
Well, it changed very minimally. It's less than 15 to change. American Airlines. We got the same flight originally, but I ordered mine straight from American Airlines, and she got hers from another website. So I got an email that my flight number changed, but
mine's leaving at 8:40.
I'm flying Southwest. I'm leaving 6:30.
Oh, okay, and then but your layover will be in North Carolina or South Carolina?
Mine's in Baltimore.
So are you going from Pittsburgh to Baltimore to North Carolina to Costa Rica?
No, I'm going.
Are you just not?
Because there's one girl, the girl that was just here, Katie. She's going from Baltimore to North Carolina to Costa Rica.
No, I'm going Pittsburgh, Baltimore, Costa Rica. But I'm flying a different airline, so I think that's why.
Yeah, mine's Pittsburgh to Charlotte to Costa Rica.
Yeah, because I looked at that flight.
You two are?
Southwest
At
8:40. So it was like.
Yeah.
And I think it's a little bit.
What time's your flight?
I think it's 8:40.
It's 8:40.
I know
Mine's early.
Oh, Baltimore.
I leave at 8:49, and I arrive in Charlotte at 9:05, and then from Charlotte to Pittsburgh.
When we get the flights, we can share information on that.
I think that's really close to actually what mine is.
Wait,
So-
when does yours leave, Allie?
Ladies, I'm going to go ahead and close the class so we can continue on with this discussion and head over to lunch. Any other questions? We'll get that flight information out to you as soon as the remaining 3 people turn in their information. We'll send it out so you all will have a printout of everyone's flights. Sound good? Okay, any questions?
Do we keep these with us, or do you take them?
I'll be happy to keep them for you, or you can keep them. It's up to you. If I were you, I think I would keep your information about this class in your journal.
Okay.
But it's up to you. If you only want to use it for homework assignments, that's fine too. Just don't lose it.
I won't lose it.
Okay.
I have a question that
Yes.
was the book.
The
like I
book.
tried looking it up, but it looks like there's like different covers and stuff. Like, would you be able to like send like a picture? Because it says like so and so is the author, like the guy that you said, but then when it, like the book cover didn't have his name on it.
Yeah, let me pull it up right now on Amazon so I can show it to you.
And how long is that book? Is it like?
It's a quick read. You can probably read it in a couple. Caroline, would you say Mountains Beyond Mountains?
Yeah, I mean, I'm a slow reader, and like it didn't take that long. Plus, it's like really interesting, like best book I've ever read.
I didn't pay her to say that, by the way.
Yeah, like, it was like my favorite book ever. Like it's really awesome.
There it is.
And I don't read.
Let's see. How do I get that over there?
We could just like come up here.
Well, I want to show our friends that are.
Okay. I think she marked it.
Okay.
Okay, now. There it is. Mountains Beyond Mountains. This is the paperback copy. You can buy it for $1.99, or you can get the Kindle edition for $12.99, or you can buy it on Prime for $11.61.
$1.99 sounds good.
Yeah, I know. Yeah. You may be able to go downtown and find it used for not much, but
It's at the bookstore too.
Oh, it is. Is it cheap there or?
I can't even remember.
yeah, it wasn't much. Yeah. Great. Any other questions? We're ahead of schedule. This is so nice. I love it. Due to my fantastic TA and her stellar support. Okay, great. And everyone has Caroline's email address? If you have any questions, please do not hesitate to reach out to either one of us. But she has been there, she's been in your shoes before, and she's a great resource to you. So please don't be shy. Go ahead and ask her questions. All right, great. Well, I'm going to go ahead and end our time together today by pushing this button. Thank you all.